We have a few alternate tests for hip extension, manual muscle testing. This first one is with the ASI. This is at the edge of the plinth. We can flex the knee here. We can keep it extended also, but to test just the glute max, we'd flex the knee to 90 degrees. Ask them to extend the hip. This test is good for patients who may have a hip flexion contracture, who don't have hip extension beyond 0. And we can extend the arm again, ask the patient to hold. This is a strong muscle group. They can hold on to the table and give resistance at the distal thigh. A 5 is max resistance, 4 is moderate resistance, 3 is a completion of the range of motion. There is no 2 or 1 for this alternate position. Another alternate position for hip extension is with the patient supine. And for this test, we grasp underneath one leg and we ask the patient to try to keep their leg next to the plinth. So they're pressing down towards the ground as the therapist is trying to lift up, and we'll monitor what happens at the pelvis when we try to lift. So I'll say, keep your leg down on the plinth, and I'll lift up. And if his pelvis lifts simultaneously with the leg without any flexion, that's a 5. If it flexes between 0 and 30 degrees before his pelvis lifts, that's a 4. If you feel resistance through your hands the entire range, but the pelvis doesn't lift up off the table, that's a 3.